So, Gigi, this was actually the first time we met, but it certainly wasn't the last. Since then, you've trusted me to help you with several different orthopedic problems. Before we talk about your hip, though, what was it about that first experience that made you comfortable coming back?
Well, from the very beginning, I felt like Dr. Adams was interested in understanding why I was hurting, not just giving me another injection. She explained everything, answered every question, and I never felt rushed or pressured. That experience gave me confidence that if I ever had another orthopedic issue, she'd be the first person I'd call.
So, let's go back to that first visit. Tell everyone what was happening with your hip.
Okay, I'm 63 years old, and although I'm retired from my career as a business executive, I stay very active. I love traveling, exercising, spending time with my family, and just enjoying life with my dog. Being active is a huge part of who I am. I had pain on the outside of my hip that just wouldn't go away. It hurt when I walked, exercised, climbed stairs, and even when I tried to sleep on that side at night. It was affecting my daily life much more than I wanted to admit.
So, what did you try before coming to LifeStem?
I tried the Advil Tylenol cocktail, but the pain would never subside. I was confident that if I went to my orthopedic surgeon, he would want to go down the surgical path.
So, what made you decide to try PRP?
What impressed me was that Dr. Adams had explained to me why I was having pain and actually showed me the problem on my ultrasound, which was a tear in the tendon. She explained that the tendon wasn't healing properly and described how platelet-rich plasma uses your own body's healing cells to stimulate repair instead of simply masking the symptoms. It did not involve surgery, and therefore the risk was minimal if it was not successful.
So, tell us about the treatment itself.
Honestly, it was much easier than I expected. The procedure was done right in the office, and I was able to go home afterward.
And where are you today?
It's been 2 years since my PRP treatment, and I am still pain-free. I can travel, exercise, take long walks, sleep comfortably, and enjoy my life without constantly thinking about my hip. For me, that's been priceless.
So, what would you tell someone who's considering regenerative medicine then?
I would tell them to learn about all their options before jumping into surgery or repeated steroid injections. I appreciated that I never felt pressured here. Dr. Adams took the time to explain everything, answered my questions, and helped me make the decision that was right for me. Looking back, I'm so glad I did it.
Gluteal tendinopathy is one of the most common causes of pain on the outside of the hip, especially in active women over the age of 50. When the diagnosis is accurate and treatment is precisely guided, platelet-rich plasma can be an excellent option for these patients. Every patient is different, but stories like yours remind us why we do what we do. Thank you for sharing your story, Gigi. It's been a privilege helping you stay active through these very different orthopedic problems, and I'm honored that you've trusted LifeStem each step of the way.